You might have heard of endometriosis, but what is it, who's affected by it, and what impact does it have on fertility? So David, can you start off by telling us exactly what endometriosis is?
Look, endometriosis is a disease that commonly affects young women premenopausally. It's a disease where the lining of the uterus that normally gives you a period ends up outside of your uterus. It seeds in the pelvis, it forms little plaques, spots, or quite large growths. These bleed at the time of the period, and because you get bleeding at the time of the period internally, it gets very inflamed. The inflammation in the blood causes pain. It causes scarring in the pelvis and can eventually lead to infertility. It's a very uncomfortable condition.
Now there's a normal painful period, but then there's also a painful period that could signify endometriosis. How do we know the difference?
Period pain that you've had ever since you're a kid is less likely to be disease-based. What we call secondary dysmenorrhea, where you start getting period pain and you haven't had it before, and particularly period pain that's sequentially getting worse over time, those are the clues to diagnosis and the ones that we really are most concerned about. But then there are other symptoms as well: pain with intercourse, bowel motion disturbance around the time of your period, pelvic pain when you're not getting a period, particularly at the time of ovulation. That mid-cycle pain is commonly caused by endometriosis. Plus, often you're generally a bit debilitated and run down because of the inflammatory nature of the disease.
And what is actually the treatment for endometriosis?
Well, the first step is to diagnose it. So a lot of endometriosis used to go undiagnosed. Women were simply patted on the head by their doctors and said, well, you've got period pain, that's your lot. What's changing is that we're now aggressively investigating it. So very often you do need an operation, put a telescope in your tummy and diagnose whether you've got the disease. The best management for any significant level of endometriosis is surgical. You cut the lesions out. That often has a dramatic effect on pain and a dramatic effect on improving fertility. Also, hormonal medications like the oral contraceptive pill are very helpful, particularly in taking the periods away and therefore also reducing the period pain.
You've mentioned fertility a bit, but what are the impacts of endometriosis on fertility?
It depends on the severity of the endometriosis. So the end point of very severe endometriosis is a very scarred, very damaged pelvis, often with big cysts growing the ovaries that are sequentially destroyed. These patients nearly always end up on the IVF program to get pregnant. Lesser levels of endometriosis have clearly been associated with lower pregnancy rates, both natural pregnancy rates at home on your bed and also pregnancy rates when you come for treatment.
Now, if somebody wants to know more, where do you suggest that they go?
Well, there's some good information on the web, and the best thing is to see your GP to get some preliminary information and then go to a gynecologist who understands endometriosis, but is also competent to do the endometriosis surgery. Endometriosis surgery, particularly at more advanced levels, is considered really quite difficult surgery. So you should really search out a specialist who both understands the disease and is competent to do the operations.